we really don't know what's happening with the new variant of COVID-19, especially in the second surge. But some of the hypotheses why it is on such a rise is that it is definitely affecting the innate and the adaptive immunity of an individual. There is an oxidative stress which is happening in the body. There is an iron overload because of mucormycosis, and we will not go into the details of how it is affecting the body because it becomes too technical here to understand. And definitely in patients who have been diabetic and who have developed diabetes during the course of the disease, because COVID is also responsible for changing the insulin sensitivity in our bodies. Now, there are a lot of studies going on. In fact, I also belong to a group of very accomplished 20 to 25 specialists in Hyderabad at Apollo hospitals, where we are looking into different aspects of how this disease is affecting, what is the nature, what is the cause, why is it affecting. So it will take a while to come to a conclusion that why in COVID-19, especially in the second surge, we are seeing so many cases. But yeah, these are some of the hypotheses. And there are certainly some risk factors which are there, as I mentioned before. The immunity of an individual is going down. There is use of steroids. Now the steroids are necessary to be given in COVID infected patients, but at the same time, if it is not given in a monitored dose, in the correct dose, steroids itself can lead to a de novo diabetic status. And if that diabetic status is uncontrolled, immunity goes down parallelly. That's where this fungi seems to be affecting our bodies. There are other risk factors as well, which have been mentioned in various forums and groups, as long-term use of antibiotics, oxygen therapy, how much oxygen has been given, and so on and so forth. But it is pretty difficult to pinpoint at one factor which is leading to it. So again, I would just repeat that if you have had COVID, whether you are young or old, and if you have had diabetes or have developed diabetes during the course, and you have been on treatment, whether at home or in the hospital, look out for these symptoms. And sooner if we can catch this disease, sooner we can deal with it, and lesser would be the morbidity and the mortality out of this disease. Because when the disease becomes severe, we have no choice but to do some extensive surgeries to debulk the fungi. One of the primary surgeries is endoscopic debridement, which is done by our ENT colleagues. So we go endoscopically and clear all the sinuses. Now, if the orbital involvement is there, both endoscopically or with the open technique, we debride as much as possible the necrotic or the dead tissue. And if the disease is in a severe or progressed form, that means it has reached to an extent where it is almost crossing the area where the eye converges into the brain, which is called the apex. We have to remove the eye completely to save the patient from the systemic complications or the complications of it going into the brain area, leading to more mortality. So that would be my take-home message for